Good afternoon, everybody. It's 2 p.m. and it's time for the do's and don'ts of Medicare, like it is every Tuesday at 2 p.m. Some of you may have noticed, some of you may not have noticed. Last Tuesday we didn't have the double D's of Medicare or the do's and don'ts of Medicare because I was with the COVID and was really not up to doing anything besides trying to manage with all that. But that's a one-time occurrence in the last year, so knock on wood. I'm a very thankful camper here that I have good health and have done so well, and was got good treatment, had already been vaccinated, and so anyway. That's what happened last week. This week, we're going to talk about a major scam going on right now here in the United States with Medicare. You need to know what is happening, and today we're going to answer that question. And we're also going to answer this question. This question that is the question of the week is, what is up if I go to pick up my prescription that I have picked up before at no cost, and the pharmacy says that this time it's going to cost me a lot? I'll repeat that question for you so that you can think about it. What is up if I go to the pharmacy that I have to pick up a prescription that I have picked up before, and the pharmacy said that this time it's going to cost me a lot? Anyway, I want to welcome you to this program, the Double D's of Medicare. So glad that you're here, and thank you for those of you who follow me regularly, and for anyone who might be new on the broadcast. If you don't know me, my name is Dennis Richards. I am a state of Florida licensed professional, financial professional for more than 5 years, 6 years now. I'm a member of the National Association of Insurance Professionals. I live in Palm Beach County. I am a Medicare specialist, and I've been doing this broadcast, the Double D's of Medicare, the do's and don'ts of Medicare, for more than a year now. And I thank everyone again for being here with us. Thank you for your support, for your encouragement, for your following. And if there's any way we can help you, please let us know about that. We'd appreciate it. So let's move right to our question right now. And our question is, what's up if I go to pick up a prescription, a Medicare prescription that I've picked up before at no cost, and the pharmacy says that this time it's going to cost me a lot? What's up with that? Well, that's a great question, and it's a question I think most of us would have if we were in that situation. We would say, what's going on here? I got that question this week, and it took me a while to get it unraveled, or to get an answer, I guess I should say, but whatever. We did get an answer, and I think it's an answer that is something that a lot of people would be a little bit surprised about, but anyway, we'll see. So first of all, that you got a prescription filled through your Medicare Part D plan, and it didn't cost you anything. You go back the second time to get that prescription refilled, and this time the pharmacy says, oh no, you have a very substantial bill to pay in order to get that prescription. And when I'm talking about very substantial, I'm talking about more than $100. So after you get up out of the floor, you can ask the pharmacy what's going on. Of course, a lot of times the people who are working at the counter may not know much about Medicare or much about how it works, or about Part D drug plans, or so forth and so on. And that was the case. They simply said, well, all we know is this is what they're saying you owe, and you owe a deductible, and you owe, and you owe, and you owe. So I got the call, and we began looking at what was going on. And so that we don't draw this out way beyond what's necessary, it really boiled down to one simple thing. The person was not being given the same prescription that they had gotten earlier. It was for the same medication, but it was not in the same form. The difference between the medication that they got earlier was that they got a tablet. I'm sorry, that's not correct. They got a capsule, and now the pharmacy was filling the prescription with a tablet. And the tablet on the Part D plan formulary or list, that's just a fancy word for list, doesn't cover that tablet in the same way that it covers the capsule. So after much ado and so forth, it was determined that all they had to do was have the doctor send the prescription back through for just the capsule and not for the tablet, and they would have no cost again. So if you run into this situation, you might very well want to check and be sure that you are getting exactly what you got before, the same medication, the same form of the medication, the same amount of the medication, etc., 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 so that you don't have costs that you don't want to be paying out of pocket. None of us want to pay anything more than we have to in the times that we're living in today. So we're going on to discuss the issue that I mentioned earlier, and that's a major scam that's going on here in the state of Florida, or all over the country actually. And that is, there is a very distinctive robo call that is bombarding as many as 60 million Americans who get their health care via Medicare. And here's how that call goes. Hi, this is Becky, your patient advocate working closely with Medicare. Currently, Medicare is offering precautionary genetic cancer screening nationwide, and has recommended that anyone over the age of 50 be tested. These tests can help detect early signs of cancer and are covered by your insurance. If you do not act soon, Medicare may label you as ineligible for coverage. Please press 1 to speak to a specialist. Bingo, bango, boom. What a phone call. And since 60 million Americans are receiving that phone call, you can imagine that a lot of them are pressing 1 to speak to a specialist. And that is a very concerning thing, because oftentimes when they speak to the specialist, the call moves forward and there are all sorts of things that are happening that should not be happening. And so I wanted to bring this to your attention today, because I think more than likely some of the people who listen to this broadcast have probably received that call. If you haven't received that call, you probably will be receiving that call, because that is the #1 robocall in almost every community in our customer base, according to various sources. I don't think you are concerned about what those sources are, so I'm not going to go through all that. But what we have learned is a number of things about the people who are making those calls and what transpires during those calls, and I think you would like to know some of that information. First of all, the calls are coming from Florida. Where in Florida? West Palm Beach, Florida. Can you imagine that? Well, I can imagine that. It's sad to have to say, but West Palm Beach has long been known as a hotbed for telemarketing and fraud. Of course, the caller ID does not indicate that it's from West Palm Beach, Florida. They say that it's coming from Cheyenne, Wyoming, Toledo, Ohio, so forth and so on. Of course, those are all types of, burner phones or whatever you want to call them, that are used to misdirect people in terms of what they're thinking about, where the call is coming from. So the calls are coming in from probably right here in our own home area. We regret to hear that that's what's taking place. Secondly, the thing that you might want to know is this, is that if you press the #1 button or push #1 in order to speak with the specialist that you're going to speak with really doesn't know anything about the genetic testing, I keep saying the wrong word, genetic testing beyond the script that they're reading. If you ask them to give you the medical name for the test, they don't know it. If you ask most any kind of thing about the test and about genes or anything related to how this test would be conducted, they have no information. So the people who are supposed to be specialists are really not specialists. They're really people who are fishing for your information. And if you're not careful, they're going to get your information. And the most important piece of information, of course, that they're looking for is to get your Medicaid, your Medicare number. Second thing that you need to know besides it, or would be the third thing, is that everybody qualifies according to the specialist that you get on the line. They ask if you've had, any tests for that cancer, heart disease, high blood pressure, etc. If you say yes to any of those things, and many others, their response is, it looks like you pre-qualify. There is no request for any medical record or doctor contact to confirm. They said that they would connect to a licensed physician if you'd like, to ask a few questions before the test was ordered, but that never was done. So the final thing that you might want to know is that if you ask the specialist about this matter of the test and whether you should confer with your own physician about ordering the test, what they say is, your doctor focuses mainly on your health. Like if you're sick, he tries to get you well, but we focus on your genes. They also said things like the doctor doesn't provide this genetic test. If he did, we wouldn't be talking. They also talk about that during the pandemic, a doctor wouldn't be able to administer the test because it's a mouth swab. Doesn't even make sense. So many things that have been presented in terms of all this. But the main thing that we need to take away from all of this is that this is a scam. If you get such a call from Becky or anyone else saying that they're calling about genetic testing for cancer or anything else, you want to be sure that you end that call very quickly. It may not affect you, but it will affect Medicare. Something that maybe many of us are aware of is there's a lot of fraud connected to Medicare claims, Medicare providers, etc. And last year, the amount of that was about 40 billion with a B, of the Medicare budget went to scammers and inappropriate billing. So you don't want to be a part of that, and you don't want to see Medicare money spent for those things. So do everything you can and tell everybody that it's very important that they not be allowed to get caught up with this scam. Here are a few things that I'll tell you in closing that I would suggest you consider not doing when it comes to Medicare and genetic test scams. How you can help with the process. Don't accept any genetic testing services, including a cheek swab from someone who calls you on the phone or offers you that at a community event, a local fair, a farmer's market, or a parking lot, or any large event. You should always take extreme caution when giving out your Medicare number or other personal information. Never, never, never offer this to a stranger. Someone on the phone that you don't know who it is, no matter what they've told you, is a stranger, and you should never give your Medicare number over the phone. If you receive a genetic testing kit in the mail, don't accept it unless your physician ordered it. Refuse it or refuse the delivery of it. Return it to the sender and keep a record of the sender's name and the date you returned it to the item. Okay, and then lastly, it's important that you review your Medicare summary notice or explanation of benefit. The word gene analysis or mononuclear pathology may indicate questionable genetic testing. What happens is that if there's any possibility that they can say you accepted this test, it's billed through Medicare and it shows up on your statement. If that happens, you certainly need to contact Medicare to refute that claim and see that that billing is stopped. I want to thank you again for being on our program today. I want to tell you that I hope that this has been helpful, and that if you find yourself in a situation that you need have questions answered, you'll contact a Medicare specialist, somebody like myself. You can contact me at 561-713-8889 or at my email, which is Dennis@Safe Harbor Financial Resources. Thank you for being a part of the show today. I hope we'll see you next Tuesday at 2 p.m. for the do's and don'ts of Medicare, better known as the double D's of Medicare. Until we speak again, be safe and be blessed. Thank you so much.